Good afternoon, everybody. Wow, I wish I were there with you, but that's life. So I put myself together, some adrenaline, and here I am. But don't worry, I'm just physically here. All the rest is there with you. So I'm here to give you a very short presentation on our role in Work Package 4. And actually, we have two main tasks in Work Package 4. One is risk assessment and management that Hamutal will present later. And the other one is the data analysis that I will try to give you a short presentation about that. So actually, what we want to do in our Work Package 4 in this data analysis is to give you really a kind of support action in any level of data that you are collecting, in any information that you already have, big data like proteomics, genetics, imaging, and so on, and small sets of data, meaning small sets of parameters, a small set of repetition with many parameters. And this is a real problem. So we have special tools that can analyze these small sets of data and provide very accurate results. And I'll present it to you. But actually what we want to do, and I know that each and every of you have his own statistician and his own tool. What we want to do is utilize whatever we can for this best whole life analysis. And actually, we are speaking on all levels, from the experimental level to the clinical trials. And actually, we want to join all the physical, the genetics, the proteomics, the imaging, any set of data that you have, and to provide the best results. And the way we want to do it is actually to provide the broadest possible insight by utilizing your own tools, your statistician, and our added value, our tools, and to provide the best possible insight, because each tool provides a different insight. And I want to converge all the tools and all the know-how. And actually what we want to do is identify the underlying rules, the features, and actually especially provide the unexpected cases and unexpected rules, those outliers that sometimes are very devastating. So the idea is to join all forces and all tools and to provide all along the life cycle of the project the best possible outcome. And therefore, I'm saying we'll utilize all the statistical available tool and all the data mining available tool and all the new developed tools, whatever we have. And just to provide you with our added value. And our added value is first the data mining that was specially tailored to fill medical, specially tailored to analyze medical and biological data. And he can handle both big data sets like the proteomics and genetics and imaging that we talked about, and also small data sets because it's less sensitive to overfitting. And how does it come? How can we be less sensitive? By combining logic theory and analytical tools, the regular mathematical and statistical tools. And this special approach based on association approach could help us in providing a different insight or an additional insight of the data. Another thing that we can analyze simultaneously, numeric data, categoric data, that means physical data and imaging data and proteomic data and genetic data at the same analysis. And that would be very important in some of our cases. Also, we can handle missing data. So we don't manipulate the data. We analyze everything as is. We don't normalize. We don't leave out any parts of the data. And we analyze all as is. And this is very important if we really want to cover whatever there is in the data. What are we providing? So we are providing to reveal proven to reveal all if-then rule and a subset, an optimal subset of strong rule. Necessary and sufficient if and only if tools that are very strong, and once you have the phenomena, you might have those rules. once you have the indications, the rules, you probably have the phenomena. And this is very strong and sometimes could be utilized as a recipe of treatment or as a recipe of understanding and the underlying rules. Another very important thing is that we are revealing the unexpected cases and unexpected rules. The unexpected cases, as I said before, could be very devastating, and we have wonderful examples that I don't have to repeat. You know it better than I do. And for each and every rule, we have the confidence level attached, what enables us to make a really reliable prediction and to provide you with the best support. So I didn't get any toxicological data or any other data set that I can present you. So therefore, I urge you, please send me any data that you have and provide me with any information that you want to be analyzed, and I promise a prompt reply, 24 hours reply. So that's it. And you know, it's very relevant this day, especially with the big fuss of criticism regarding reliable analysis, regarding repetition of experiments. So here is a tool that I can help you with. I just wanted to give you some flavor, some feeling on what can we provide. As I said before, I didn't get any toxicological data, so I took data that I analyzed before, and in this case, it's neurodegenerative disease that I analyzed to reveal the underlying markers or to looking for markers for Alzheimer's disease versus MCI, mild cognitive impairments, and normal patients. And this data was analyzed utilizing our data mining tool. And as you can see, the first rule is kind of known one, which is very important. It's the protein expression of PAPA, and it's known. And that's very important because it provides us the strong or reliable ground that we reveal the right things. And that's what gives the power to look on the small groups, on the other groups that we reveal, the other rules that could be less seen in other way of analysis. And as you can see here in this data, the reason I chose this example is because it shows the protein experiment and the fat analysis as well, which is the joining force between the two. And this is very, very important. And in this case, the analysis is not very good. I mean, we are just succeeding to present 71% of the Alzheimer's disease, but still it provides the reason I chose this to show you that we can show the protein expression and the fat as well. And as you can see here in the parameters, part of them you probably know, the BNP that is very known as cardiac ventricles, and probably you know the others, but it is just an example. All in all, we were very good in presenting 85% of the various groups in the data, but I hope to do better with your data. Another example, just to give you a different insight, is the dialysis patient, those that are receiving apoetin administration. And the question here in this data set was whether they can survive. How problematic is the apoetin administration to those dialysis patients. And here we were looking on those who survived 1 year, 3 years, and 5 years. And as you can see here, you see age or other physical measurements or parameters or rules and the treatment that they are receiving. But the reason I showed you this example is that we took, in this case, part of the data as learning mode. We choose 400 records that we randomly chose, and we studied the rules on these 400, and the rest 100 we predicted based on the rules that we extracted. And as you can see, we did very well. We had 8 misses and 5 false alarms. This is just, as I say, to give you a flavor, to show you what we can do. I promise that if you send me your data, we'll do it quickly, and we can work on that and go deeper according to your guidance. Another added value that I want to offer you is the false discovery rate. The FDR is one of the most quoted papers and quoted statistical analysis for clinical trials, which is very important these days. And actually, what we want to do is reduce the rate of type 1 errors and encourage the power. So we are building a kind of a threshold to the clinical trials to provide less fast discovery rate and provide better analysis or more reliable analysis for clinical trials. These days we are working together with Professor Yoav Benyamini from Tel Aviv University, who developed this false discovery rate and combine it with our data mining, and we hope to utilize it to put it to your use as well. So that's it. So just to summarize, this is our role in the project. First of all, I am here to help in experimental design, in any analysis that you need, any evaluation of toxicological data, and utilize the FDR. The rest, the safety risk assessment and analysis, will be presented by Hamutal. And I wish you a very productive meeting, and I'm there with you. Thank you.